believes that South Africa will experience a slight surge in COVID-19 infections in the coming weeks as the festive season draws to an end. After a significant drop, it appears as if the numbers of new COVID-19 cases is rising again. Meanwhile, according to the National Immunisation Safety Expert Committee, South Africa did not reach its COVID-19 vaccination target by the end of 2021 when the vaccine was rolled out in March to the country's healthcare workers. The government intended to vaccinate almost 70% of the adult population by the end of 2021. However, a number of challenges have left the country's vaccination figures low. By the end of 2021, almost 28 million doses were administered. Around 15.7 million people are fully vaccinated. Let's take this discussion further then. We are now joined via Zoom by Dr. Lesley Bamford. She's the Chief Director for Child Health Program and COVID-19 team leader for the Department of Health. Dr. Bamford, always a pleasure to see you. Thanks for giving us your time as always.
Good afternoon, and good afternoon to the viewers.
So, of course, we're hearing that there will be a surge in COVID-19 infections in the coming months after, that significant drop that we did see. Let's talk about what the major causes of this are.
So I think we know that we have currently experienced a fourth wave. We also increasingly, we know that during the pandemic, we experience surges or waves. The numbers have been coming down, but we will need to wait and see what happens to the numbers in coming weeks. And we know that we will inevitably experience further waves, but we will have to really wait and see when those waves arrive and how serious the waves are. Yeah. As we know, during the fourth wave, we experienced a very rapid increase in the number of cases, but with fewer hospitalizations and deaths than in some of the previous waves.
Yeah. In December, we were all warned, and it happened, of course, that we did have the fourth wave, and there was, prior to that, there'd been a lot of panic, but it seemed as though things were fine. In fact, government decided that there was no curfew for New Year's Eve, since New Year's Eve, and I suppose that made people kind of relax and kind of think that, okay, we're past the worst part of COVID-19, and I wonder if that's true. I wonder if that impression that might have been created might have been a bit of a problem, especially in terms of people then not really complying with COVID regulations.
Well, going forward, I think we all know that we face a very difficult task. We have to open up the economy, open up society, but we do need to do it in a responsible way. So we really do just need to stick to the basics, encourage as many people to continue following all the non-pharmaceutical interventions, all those interventions that we know extremely well, keeping away from crowded places, being in well-ventilated areas or outside, wearing masks, and other basic washing our hands, etc. And then, of course, the ongoing importance of being vaccinated. So you certainly are correct. Although we have moved into lower levels of lockdown, some of the restrictions have been lifted, all of these interventions remain critically important.
Yeah, you're talking about vaccinations, and South Africa did fail indeed to reach the target that it had set for last year. What are some of the factors in play that are are the reason that we are missing this target?
Well, I think we know that in the early phases of last year, the first half of last year and the early part of the third quarter, we did face significant constraints in terms of availability of vaccines. But later in the year, we had enough vaccines. We have more than sufficient number of vaccines. And our biggest challenge in terms of the vaccination program is with people coming forward and being willing and presenting themselves to be vaccinated. And certainly in the past few months, we have seen a slowdown in uptake of vaccines, and that has contributed significantly to our failure to have vaccinated as many people as we would have liked to.
Yeah. Doctor, the other issue that's becoming quite topical is the issue of booster shots for those, who have been vaccinated. I really want to talk about, those who are, for lack of better terminology, those are being left behind, as, people are now talking about having boosters. Those that are seen as fully vaccinated are now talking about getting booster shots. What is the process now in terms of getting people to catch up? Those who haven't been vaccinated will obviously be then left behind if people are now starting to have booster shots and other shots that are coming afterwards. I mean, is that going to be problematic for the department, because you're dealing with a large group of people who aren't vaccinated, and then you're also now having to deal with those that need to get their booster shots and so forth?
So currently we have enough capacity in terms of vaccines and ability to vaccinate, to administer the vaccines, to provide both booster shots as well as to vaccinate people who have not yet been vaccinated. And I think we must be very clear that that latter group does remain our priority. We are offering boosters, but our number one priority remains to reach people who are unvaccinated and therefore not protected against severe disease and death associated with COVID. So that group really remains our number one priority. Having said that, as you correctly indicated, we are now offering boosters. And just to reiterate, we are doing what's known as homologous boosting, which means that we're not mixing and matching. So people who received the Pfizer vaccine, that's the 2-dose vaccine, are eligible to receive a booster 6 months after their second dose. So currently that's a relatively small number of people, but in coming weeks and months, more people will become eligible, and we would encourage those people to come forward and have a booster. The Johnson & Johnson vaccine, that's the 1-dose schedule. Anyone who was vaccinated 2 months or more ago is now eligible to receive a booster dose, and we would encourage those people to visit a vaccination site and to receive their booster.
All right, Dr. Bamford, thanks as always for being with us and giving us your time. Dr. Lesley Bamford is the Chief Director for Child Health Program and COVID-19 Team Leader for the Department of Health.